So I would verify my order, I'd gather up all my supplies, I'd come into the room, I'd introduce myself. Hi, I'm Alex, I'm your nurse. I'd verify their name and date of birth, ask them about any allergies they had, provide privacy for them, and then I would explain the procedure to them. We're just going to put in an NG tube through your nose and down into your stomach, and then I'd ask them if they had any recent nasal problems like polyps or deviated septums or recent cold or anything like that. Then I would do hand hygiene. And I'd adjust my area so I'm on the right side and I can use my dominant hand better. I'd raise their bed up to about hip height and then raise the head of the bed. Then I would check the suction device is working. It is, and it's connected. Then I would do hand hygiene again. And then I would set up all my supplies and get my NG tube opened up. And I would put the lubricant in the packaging, but not for the video. Then I'm going to put on clean gloves. And I'm going to use a pen light to look at their nasal passage. This looks good. And then I'm going to assess their gag reflex. They have one. So then I'm going to make a safety response. I'm going to have them raise this hand whenever they need me to stop or slow down during the procedure. Then I'm going to put the sheet over them. Any tissues in their water right now, in their emesis basin. Then I'm going to measure the tubing from the tip of their nose to their earlobe and then down to their xiphoid process. So I got 63, and I'm going to lubricate the end of the tubing. And I'm going to attach the syringe. And now it's time to insert it, so I'm going to have them tilt their chin down to their head, or their chest, and then once it hits the back of their throat, they're going to tilt their head back and look up and lean back. And then they're going to be taking sips of water while I'm inserting it. So 1, 2, 3, tilt the head down. Hit the back of the throat, so they're going to look up now. And every time they swallow, I'll push the tubing in a little bit farther until we reach the right length. 63. Then I'm going to use the pen light to make sure it went down correctly, and it did. So now I'm going to take my tape, secure it to their nose. Now, I'm going to use my stethoscope and inject the 50 cc's of air so I can listen for the whoosh sound. And there it is. And I'm going to aspirate some of the stomach contents. adjust the pH. It should be from 1 to 5, and it's about 4 or 5. So now I'm going to secure it with the pin further down. And now that it's secured to the patient, you would need to get an x-ray order in, and we would lock the line with the connector. So the x-ray came back and it confirmed the placement, so now we're gonna hook it up to the suction tubing. Put it at intermittent suctioning, and now that they are hooked up to the suctioning, I'd ask them how they're feeling, if they needed anything else from me. I would clean up the area, I'd lower the bed back down, and lower their head to semi-Fowlers if that's what they wanted, so we can't go any lower than that. So then I would clean up my stuff, throw my gloves away, do hand hygiene. Then I would leave and document that I put their NG tube in. So now it's time to take it out, and we just got an order to remove it. So I'd verify the order, I'd gather up the things that I need. I would come into the room, introduce myself. I'm Alex, I'm your nurse. We got a new order to remove your NG tube. Then I would explain, I'd verify their name and date of birth, and I'd explain that I need them to take a big deep breath in, and on the way out I would pull out the tubing in one big motion. So I'm going to raise the head of the bed back up, put it higher again. Do hand hygiene. Put the gloves on. I'm going to put the pad back on them, or a new one on them. I'm going to remove the skirmit pin. The suction would already be turned off at this point. That's on their face. Then I'd give them any tissues, emesis basin, and some water to drink afterwards. And now they're ready to get it taken out, so I'd have them take that big deep breath in. And then when they exhale, it'd be hand over hand. It's completely out, and I would wrap it in the absorbent pad and throw it away. And then once the pad is thrown away, I would ask them how they're feeling and if they need anything else. Then I would clean up my area again and lower the head of the bed and the whole bed to a comfortable position. my area, give them their call light, take my gloves off,